What happens with patient, doctor, nurse, patient interaction? What's the usual interaction? Because one of the complaints usually here from patients is that, I don't think my doctor or my nurse really listens to me. I don't think that I have their full attention. And if you're a nurse or a physician watching this, what can you do to improve your listening skills? And a lot of these things translate to home so that you can take them home. I'm not claiming to be an expert at this. But the typical physician-patient interaction is we're not good listeners. We usually wait about 10 to 12 seconds before we interrupt because we're usually thinking about how we're going to respond rather than listening. So you come to me complaining of headaches and you start to tell me about it, and I'm already focused on, I think this is going to be migraine, and this is what I'll tell you. And after about 12 seconds, I start asking questions that are going to take me down the path I want. Whereas if I'll just be quiet as a healthcare provider and listen for 3 or 4 minutes, I'm usually going to get the story. Now, sometimes the patient goes off on a tangent and you've got to redirect and let's get back to what we're talking about. But most of the time, we need to be quiet for that first 3 or 4 minutes. We need to remove distractions. And what's the great distraction today for healthcare providers? Electronic medical record. So that how many of you have gone to your physician and while you're talking to them or the nurse who's come to take your vital signs, and they're typing away and they're looking at a screen rather than having eye contact with you. So if you're a physician or a nurse, think of a way, how can I stay focused, have eye contact with you, and not be looking at my screen or looking and making notes. And the patient will know that you're actually listening, and it'll improve your listening skills. Because as much as we say, I'm really good at divided attention, I'm really good at multitasking. No, it's usually at the sacrifice at something else. And be empathetic. One of my campaigns these days is to teach people to say, I'll bet this is difficult. So if you want to be a good listener, focus in on what the patient's saying and then acknowledge that what they're going through is a difficult experience. Do head nodding. A lot of times people think, they're just nodding their head, but it shows that you are paying attention and there may be some agreement. And then finally, you need feedback. Once I've listened, rather than just go into an explanation of, this is what we're going to do, as a nurse, as a therapist, as a physician, what I ought to say is, so my understanding is that you've come to see me because of, and do that. The opposite of that is what's called a teach back, is if I've explained to you what I want to do and I want to know that you as the patient have been listening, I may ask you, now, what's your understanding of what's wrong with you and what's your understanding of what I'd like you to do? So hopefully we'll all become better listeners.